Good morning and welcome to Coffee and Conversations. I am Dr. Maria Doucette, and today the topic is going to be preparing for cold and flu season. So as we all get excited about the crispness in the air and getting ready for the holidays, the only unfortunate thing is that it does herald our cold and flu season. And let's just take a moment to get ready so that we are prepared for that. I'm just going to go over some suggestions to help you get ready, and most of these are things that you are aware of, but sometimes just sitting and talking about ways to be prepared reminds you of some of the things that you could be doing to get ready. So these are just 7 simple things that we can do to think about to get ready for cold and flu season. Number 1, stock your medicine cabinet. So if you are like me, I know in my mind the things that are in my medicine cabinet, but it's probably been a while or maybe even since last year that I looked at expirations. So as you go through your medicine cabinet, toss out the things that are expired. Make sure that you have some of the basic things that you will need during this season: a decongestant, an antihistamine, a pain reliever, a fever reducer. These are some of the most common things that, if someone is sick and it's the middle of the night or, over one of the holidays, you want to make sure that you have some of these basics ready. A cough suppressant is helpful. Throat lozenges are helpful. I find that having these things in both a liquid form and a pill form is helpful, because sometimes even for adults, if you have a sore throat, it feels better to swallow, just say for example, Motrin in a liquid form. So having both, I do think, would be beneficial. So number 2, load up on other health supplies. So I am a firm believer in sinus irrigation. I know it's not everyone's favorite, but during this time of the year, rinsing your sinuses definitely helps to decrease the load of antigens or bacteria or viruses that are on the inside of your nose. And physically rinsing your nose can act as a topical decongestant, which makes less of a load of the medications that we need to control your symptoms. It can help prevent infections, because if we're rinsing the nose and decreasing the load, it's less of it to sit on the inside and contribute to an infection. So most important thing, do not share. Each family member should have their own. They can be washed or decontaminated. There's some instructions on the box that tell you how to clean them, but it is meant to be something that is disposable, replaced every couple of months. So just make sure you have 1 or 2 of these kits in your pantry, because I do think that it is extremely beneficial as we head into this season. Of course, other items such as Kleenex, hand sanitizer, antibacterial wipes, bleach wipes, a room humidifier, a thermometer. Check your thermometer, make sure that it works, make sure that it has new batteries. I also am a firm believer in vitamin C and vitamin D. So it is easy to get your vitamin D level checked by your primary care physician, and most of us do have low vitamin D levels because it is not an element that our body makes naturally. In order to have vitamin D, we have to have sun exposure. Most of us don't get adequate sun exposure, which would be at least 30 minutes a day. So you might want to check with your physician, see what your vitamin D levels are looking at like, see if you need replacement. I do take Emergen-C, which is a high concentration of vitamin C daily. I do feel that it helps as an immune booster. I feel that the literature is not 100% in support that it makes a difference, but I personally take it every day and I think it makes a difference, and I see and take care of sick patients all the time. So vitamin C might be one of those things you want to add to your armamentarium as you prepare for the season. Number 3, comfort food. So we all know that chicken soup is a necessity during cold and flu season. I like to prepare for this season by purchasing some of the pre-prepared soups that you can get either at Whole Foods or some of the groceries that I can just put in the freezer so that I can be ready if someone is sick. I think it's good to have options like electrolyte drinks and waters and popsicles. Popsicles feel great on a sore throat. So just think about what's in your pantry and what ways you can be ready if someone gets sick, so that you have something ready to go all the time. I also like the insulated cups, like for example the Yeti cups. And I find the insulated cups with straws are very helpful to fill with soft ice. If you have a sore throat or a sinus infection, it just feels really good to drink something cold. So most of these things are things that you already have available in your house. I'm just sharing from my perspective. I like to make sure that those things are ready to go. Number 4, prevention. So we all know that with the start of October, the flu vaccines do become available. So it's time to start thinking about getting on a schedule to get your flu vaccines, either through your pediatrician. There's a lot of pharmacies that now offer it, and the convenient thing about that is you can go 24 hours, any time of the day or night to get your flu vaccine. So every year the flu shot is a little bit different. So they try to predict which strains are likely to be the strains that cause the flu this year. So you hear of the quad flu shot or the 3 trivalent flu shot. So even though you had a shot last year, you have to get a shot every year. And even though you get the shot, you can still get the flu. The difference is if you've had the vaccination and you do get the flu, your symptoms are usually much less severe than they would have been if you did not get the shot. So you might want to just start looking into where you're going to get your flu shot this year. Common colds are common this year. This time of year, you cannot get a vaccination against the common cold, but this is where hand washing and sinus irrigation comes in. The more you can physically dilute, the less likely you'll have a cold even that turns into a more significant sinus infection. And then the next thing when we talk about prevention is allergies and nasal congestion. So we're having a change of seasons, we're having frequent changes in barometric pressure. So it is not unusual, especially for children, to have a runny nose. And usually I feel like, treat it or don't treat it. As we enter into this season, I say treat a runny nose. Even if you have to take a nasal steroid or an oral antihistamine, the more we can keep the nose dry, the less irritation on the inside of the nose, the harder it is to get an infection. If you let allergy symptoms go on for a few days without treating them, it's easier to get a sinus infection. So a sinus infection occurs when there's inflammation on the inside of your nose. That goes on for a while. That causes fluid to get trapped. The bacteria that lives on the inside of your sinuses starts to work on that. So during this time of the year, I say at the first sign of a runny nose, start either rinsing your sinuses, for children, spraying a nasal saline spray, taking an antihistamine. That can kind of help prevent things from progressing on until the next level, which would then be an infection. So those are just some of the things that we can do for prevention. Number 5, take care of yourself. So we all know that eating a healthy diet, regular exercise, getting enough rest, these are the things that are necessary to maintain a healthy system regardless. But I do find that despite the fact that we all know that this is what we should be doing, sometimes we don't take the time to incorporate these things into our lifestyle. So the first thing I start with is diet. There are many alternatives today that we can use to take even some of your favorite recipes and turn them into healthier alternatives. Like, for example, cauliflower rice can be used to replace regular white rice. Zucchini noodles can be used to replace noodles. I've started making some of these small changes even for my own family, and I usually don't announce beforehand that I'm making a healthy choice, because that definitely would lead to some resistance. But it's amazing what I've been able to get away with. So just try to make some small changes to the things that you normally enjoy making to incorporate more fruits and vegetables into your diet, or to think of how you can take those things that we all enjoy eating and just have them, a slightly healthier alternative. As far as exercise, with the weather being so nice outside, it's a great excuse for us to say, let's just go out and at least walk for 30 minutes a day, something to get out in the sun, get some vitamin D exposure, and incorporate some sort of exercise into your daily routine. The next item on the agenda is sleep. So many of us aren't aware of our poor sleep habits. And if you have a watch that records your sleep or any device that records your sleep, it's amazing how you actually get much less sleep than you think that you're getting. So there are lots of apps that you can use now, or even to set an alarm to remind yourself to go to bed at a certain time every night. That helps to incorporate and reinforce good sleep habits. So any of these things to track to make sure that you're getting at least 7 to 8 hours of sleep at night does make beneficial. And then the last thing on my take care of yourself section is reflection. So I try to take a few minutes of every day for quiet reflection, and it can be through simple things like having your coffee outside and just enjoying the weather and listening to the birds. It could be, watching your family come in at the end of the day and the hustle and bustle and just taking a minute to count your blessings. But just setting aside a few minutes a day for mindfulness and reflection, I think just reminds you of the blessings and joys that you have on a daily basis. And sometimes we get so busy with the work of everyday life that we don't stop and reflect on the positive aspects. So take a minute, especially with the holidays coming up, for some self-reflection. The sixth thing on my agenda is stop the spread. So frequent hand washing, we all know, abates many illnesses and many ailments. But one of the things I think that is easy to overlook specifically is the bathroom. So if someone is sick at home and they blow their nose, of course you can dispose of the Kleenex. But we don't always think about, touching the faucet, using the hand towel, surfaces that are touched. So having bleach wipes on hand is helpful to wipe down bathroom surfaces and knobs. I do think that this time of year, if you can look for disposable napkins for your bathroom so that you're not all using the same hand towel. There are many viruses and bacteria and organisms that can stay on inanimate objects for hours to days. So, if someone at home is sick and they wash their hands and they touch the towel and someone comes behind it and uses that towel, that's an easy way to spread it. So think about getting some disposable napkins for your places where people wash their hands. I also like to use an antibacterial soap, and there are antibacterial soaps that are touch-free. You put your hand under and the soap dispenses out, because if you get a soap that requires touching or pumping or physically touching and then putting down, once again, organisms can stay on that surface. So a touch-free antibacterial soap or hand sanitizer is really one of the best options. So I do think stopping the spread is important. Of course, encourage teaching your children, if they have to sneeze or cough, to either do it in a tissue or to use their elbow so that it's not aerosolized for everyone else to experience. And then we all know not to share food, not to share utensils, especially if someone else in the house is sick. So the seventh thing on my agenda is tender loving care. So this is always one of the most beneficial aspects of caring for someone who is sick. And as parents, we wear many hats, but when someone is sick at home, that's when we really have to, step up to the plate and take care of them. So as a mother and a wife and a physician, I feel like many times the only thing that you can offer is comfort care. Common cold, we can't really actually treat the cold, but we can be prepared with some of these items. I like to keep a basket with all of my supplies in a basket, so that if someone gets sick at home, I'm ready with my basket of supplies, my blanket, my pillow, ready to show those I adore that I am ready to take care of their needs. So I do feel that at least 50% of recuperating is feeling like you are cared for. So hopefully these tips have been helpful. I'm going to include a shopping list so that if you just want to print or take a screenshot of the shopping list, may help you remind you of the things that you'll be looking for when you go to try to stock up on some of these supplies. So stay safe. Happy fall, y'all, and we look forward to healthy days ahead.